While empirical Raman spectroscopy models are convenient due to their black box properties, they may prove impractical and insufficiently robust for deployment as process analytical technology solutions in complex upstream bioprocesses. Now, in contrast, the MAVERICK platform based on Raman technology with a de novo approach operates as effortlessly as a pH meter, providing real-time measurements of key process parameters such as glucose, lactate, and biomass, while also providing access to high-quality, full-spectrum Raman data, facilitating comprehensive bioprocess development. I'm Miles Skoda. This is the Life Science Connect webinar series, and today we're talking instant implementation of Raman-based monitoring and control for key upstream bioprocessing parameters. Now, joining me for this presentation are two industry experts from 908 Devices. First, Dr. Stephen Driscoll, Senior Scientist for Algorithms, and Dr. Steph Klaubert, Senior Scientist for Bioreactor Operations, who are going to provide an overview of the MAVERICK solution, including its operational mechanism and foundation of its measurements, along with an example of implementing MAVERICK for continuous CHO feed control, including novel feeding approach. Now, we'll be holding a Q&A session following this presentation. Please feel free to submit questions as we go along. We'll get to as many as possible during the Q&A, and any that we don't get to, we'll follow up on after the event. And then just a bit of housekeeping. If you run into any issues today, please try refreshing your browser first. If your problem persists, submit a question through that Q&A, and I'll help get you back on track. And then this event will be available on demand. It's usually within 24 hours, often less, and you'll get an email with a link to it, or you can just use the same link that you used today. So, with all that said, I'm going to turn it over to Dr. Driscoll to get started.
Awesome. Thanks, Miles. So I really like to just highlight that we actually have four devices that can help you get critical insights into your bioprocesses. Whether you want to do offline analysis with ZipChip to look at CQAs, or use Rebel to do at-line media analysis, or even use the MAVEN to do kind of real-time monitoring of glucose and lactate, or MAVERICK where you can do glucose, lactate, and biomass, we kind of have you covered on all fronts depending on what you want to do. I'm sure everyone in this webinar is familiar with process analytical technology, PAT, but I'm just going to go over kind of the spirit of PAT because it kind of motivates our device development direction when it comes to MAVERICK. So in 2004, the FDA released its guidelines on process analytical technology, really highlighting that we should be moving kind of away from these offline sampling and testing strategies more towards online or inline methods with automation, with the ultimate goal of kind of enabling real-time process control to improve and ensure product quality. So this kind of spurred the industry to start developing more innovative sensors, and even doing algorithm and modeling improvements. But what we're going to be talking about today, MAVERICK is kind of in the spirit of trying to adhere to these FDA kind of guidelines for PAT. So it begins here, Raman for bioprocess monitoring. If you look in the literature for kind of the joint searches of Raman spectroscopy and bioprocess monitoring, you can find a ton of citations. If you plot it up this way, so a number of citations as a function of year, you'll notice that they're growing exponentially. So a kind of easy question to ask is why is there so much interest for Raman being used in bioprocessing? And I think it's a pretty simple answer. It's not a trick question. Raman provides kind of relatively non-invasive access to your critical process parameters and critical quality attributes in a range of bioprocesses. For those who are not familiar with Raman as a technique, a system is comprised of mainly three components. You have your laser, you have an optical probe, and then you also have a spectrometer. So what's happening physically is you're shooting your light into your sample. You then collect the light that's inelastically scattered by your sample using your optical probe, and then you spread that out onto a spectrometer. The resulting spectrum here on the bottom left, I'm just showing some spectra overlaid, is actually pretty selective for chemical functional groups, and the intensity is proportional to concentration. So it's perfect. It's a perfect response if we want to use it to kind of predict analyte concentrations or other attributes as well. This review here by Buckley and Ryder is actually a pretty good summary of what people have used Raman for. in terms of detecting analytes. It includes their limits of detection, the concentration ranges they were looking into. But people have also looked at using Raman to do stuff like predicting aggregation and titer as well. So how do you go from this information-rich Raman spectrum to predicting, say, glucose and lactate or titer? The answer here is the usual kind of chemometric workhorse algorithms. These are your partial least squares, PLS, your principal components regression, PCR. You can find these everywhere in the literature. Everyone just kind of blindly applies them to any multivariate problem. All of these, I'm not mentioning all of the other ones on the top right, but there's a ton of them, kind of fall into the same kind of workflow of what you would actually do in practice. And you can split this up into kind of two stages, so the development and the prediction stage. So step one is you need to hoard a ton of observational bioprocess data along with reference values to actually begin building these models. If you're smart enough, you'll try to measure kind of perturbed versions of the bioprocesses that you wish to predict in, just to kind of increase the range or application range of your model. And then you start trial and erroring. So building the PLS models, building the PCR models to arrive at this linear estimator here, that B hat. So when we recorded a spectra using a spectrometer, we multiply by this B hat and it gives us our predictions for analytes or titer or whatever we're trying to predict. In the prediction phase, you're still kind of continuing data collection and then just empirically deciding whether or not the model's performing correctly using stuff like Hotelling t-squared or Q residuals. And then when you notice that your model is drifting a bit, so whatever you're measuring is not kind of matching to your training set, then you have to go back to step one and start collecting more data. So there are advantages to this approach. I know I'm kind of putting it in a negative light, but the advantages are that you can find this software pretty much anywhere. If you do a Google search, you can find free available software to do PLS or PCR. You don't need to know any domain knowledge, so you don't need any understanding of chemistry, physics, biology. You can just dump your data in, press go, and it'll give you a number, which is kind of scary. But there's some very kind of severe drawbacks to applying these types of methods to bioprocessing, and I'm going to go over a few of them. Just like to mention that all of these drawbacks are just a symptom of kind of mismatch between the modeling framework and the application that you're applying this modeling framework to. So the first one here is bioprocesses by definition are extremely correlated. You have a system that's pretty much totally contained and things are extremely correlated with one another. That's analyte concentrations, the error model of the total system. Where this comes into play is when you need to be very, very careful when you're doing cross-validation for these types of data sets, because you may be tricked into thinking you can predict something that you're actually not predicting. Another drawback here is the stationarity issue. So these routine methods like partial least squares, PLS, assume that the covariant structure of the data, that's both the error and the kind of analyte concentrations themselves, are constant, which is never true for Raman. It has a variable kind of error structure. And it's certainly not true for bioprocesses because they're definitely correlated over time. So I'm just plotting some made up kind of concentrations here for some components as a function of bioprocess days, but this is kind of in general what we would see for a bioprocess. And you can see that things are either negatively correlated or they're positively correlated. There's no independence going on in this case, which is a big problem for the kind of black box models like PLS and PCR. Another drawback that I'd like to mention is the usual analytical kind of figures of merit. So that's your selectivity, sensitivity, precision, accuracy. You can't really get these from the models, and the software is certainly not providing these. You have to kind of do carefully designed external experiments to even estimate these things. So you kind of really don't know if your model is performing well, other than just doing a straight comparison at the time to some external reference value. And then if there's anyone on the webinar who has actually done this stuff in practice, like I have, you know that it's just trial and error. There's too many different algorithms, there's too many different pre-processing methods, and the combinations of those that you kind of just need to search through them all and then see what gives you your best performance. But in reality, you're going to overfit every time if you do it that way. So when you go back to the kind of prediction step of your newly trained model and it starts performing poorly, it's probably because you overfit on the training set. Another note that people often overlook, especially with Raman, is that the spectrometer, they have unique kind of device-specific characteristics that are different enough between spectrometers that it's annoying when you start to model them. So these black box methods such as PLS will pick up on this variance difference and then try to use that as a correlating factor to predict whatever you're trying to predict, so glucose or lactate, when in reality, obviously, that is not truly what you want to be using to do your prediction. And then finally here, the regulatory overhangs, so the FDA kind of guidance for multivariate models is super squishy. So trying to do validation with their guidance there can be extremely painful with these models. So if you do choose to go this route, and plenty of companies do still choose to go to this route, you need to pay a cost, and the cost is both in time and money. The training for these types of models is on the order of months and years to start collecting expensive bioprocess data. You need to hire in a domain that's kind of not easy to find. You need to get a chemometrician who knows what they're doing. And even then, you're not guaranteed that your model will be kind of sustainable and robust. Say you change one variable in your bioprocess, you get mad at your chemometrician now because your model's not working. Well, that's because it's not represented in the training data. So you have to go back to step one, and now we're spending another couple months generating expensive data to make this model more robust for our new kind of bioprocesses. So this all motivates kind of what we were after when we were developing MAVERICK. We wanted to take the kind of this cumbersome training step that takes forever and is super costly out of the hands of the kind of user and kind of redevelop the mathematical framework to offer kind of immediate value by just taking the system out of the box, doing a quick calibration, and then the user being able to get values for glucose, lactate, and biomass. So that's what I'm going to be talking about today. I'm going to be going over just kind of under the hood briefly what's going on with MAVERICK and how our approach differs from the PLS and PCRs, those type of algorithms. This is a picture of the device here. On the top right, we have the measurement hub. That's where you can kind of see all of the data, and that's kind of coordinating all of the measurement modules, where I'm just showing one of those below the hub there. So you can actually have up to 6 of those measurement modules connecting to the hub, and those 6 measurement modules can be recording in 6 different bioprocesses. I'll go over a bit more of the specifics of the device at the end of my section here, but I just wanted to show you the device. I like this slide here because we're starting where everyone else is starting. We're not doing any magic. Our MAVERICK device produces Raman spectra just like any other Raman device. So here's just some spectra from a 14-day CHO process overlaid on one plot. You can see it looks just like any other Raman spectrum. We're starting from this data here before we get into our own mathematical framework. So I'm going to be walking through our approach and how it differs and what the advantages are compared to, say, something like PLS. I don't have much time today to go through the nitty-gritty details, so I do encourage you in the webinar resources. We have a great MAVERICK de novo white paper. So if you're kind of technologically inclined or interested in this type of work, I encourage you to go check that out. There's tons of information there. So we call the MAVERICK model or the MAVERICK approach a de novo approach. De novo meaning kind of from the bottoms up. Our model is built actually dynamic in time, so we still are producing this best estimator B. So when we measure a incoming Raman spectrum, we multiply by this B and we get out our predictions of glucose, lactate, and biomass. But we're actually building this B dynamically every time we get some new data. So some of the disadvantages I talked about earlier were purely just a function of time. So obviously our framework has to have some dynamic component in there. So we have both static and dynamic components with respect to time, and I'll go through just kind of high level some of the components for both of those. So in the static components, we have a formulary reference that just contains spectra for kind of what we expect to see analyte-wise in most bioprocess runs. We have a formulary prior. That is kind of this Bayesian term where we can tune the covariance between these different components in the formulary reference. That kind of solves the stationarity and the covariance problem I was explaining earlier. We have a system filter function. So each of these devices we build at 908 has its own unique specific system filter function that kind of describes device-specific characteristics, whether that's the error or its response or sensitivity. We take that all into account when we build our model. Dynamically, so at each frame of data we get, we're updating the physical measurement error model. We update that in real time. Since Raman spectra suffer from shot noise, that changes over time. It's not independent, so we update that at every frame of data. We also have an environmental model. So anyone who's run Raman spectroscopy knows that it's kind of impacted by stuff like ambient temperature and say fluorescent lights in your lab. We have a model that kind of soaks all of that stuff up. Just a note, when people are building models, say with PLS, if you don't have stuff like fluorescent light spectra or examples in your training set, then your model will not work in that scenario, which I've seen a bunch of times. We take that all into account with this kind of simple environmental model. And then finally, we have a time domain dynamic model. So if you think of the kind of concentrations of glucose and lactate over the course of a 14-day bioprocess, say a CHO run, those are pretty slow moving relative to kind of the sampling rate for our Raman spectrometer. So we can exploit that kind of relationship to increase the precision of our reported predictions for glucose and lactate. This is all de novo. Empirical bioprocess data never actually trains the model. You don't need to hoard any reference data or expensive bioprocess data. There's no need to do any of that. This is all handled by the way we've kind of built this framework to do the modeling. It's totally unsupervised. Zero training set involved. Another advantage here is that you can, from the mathematical framework, derive the analytical figures of merit. So that's stuff like your root mean squared error of prediction. So that would be the performance that you're expecting to see from the model. Stuff like selectivity, sensitivity. I'll go over in the next slide how that's possible, and it's definitely in that de novo white paper. So be sure to check that out as well. And then a single model for all analytes in the system. We actually just build one model at every step or every frame of data we get. If you use PLS or PCR, it's not uncommon for people to kind of build one model for one analyte, another for another analyte, and then keep doing that. And then you just end up with this kind of spaghetti framework of models that gets really complicated and should be kind of yelling at the person developing it that this is probably not the right way to go. Ours is just one model for all the analytes in the system. Nothing really changes for analyte-specific modeling. Again, we have complete control over the covariant components through the definition of this kind of Bayesian term, this psi I'm calling it here. So we can tweak that on our end to kind of solve the stationarity problem. So this is a scary slide. We won't actually go through the math here, but I think it's important to note that you can get explicit or closed form expressions here for selectivity and sensitivity and your root mean squared error prediction, all from the mathematical framework without even putting the probe in a bioprocess. I encourage you again to go check out that MAVERICK de novo white paper where we plot some of these up as a function of time during a bioprocess so you can see how they behave. But it's a huge benefit, especially in terms of development for this framework compared to something like PLS, where you can't really get access to this stuff a priori. And then finally here, before I hand it over to my colleague Steph, MAVERICK really is just kind of like the simplicity of a pH meter where you take it out of the box, do a calibration, put it in your process, and you can get estimates for glucose, lactate, and biomass for mammalian, CHO, and HEC-293 processes. You don't need to collect a bunch of modeling data or reference data. You can do it in the daytime, nighttime. You can turn the fluorescent lights on, off. You don't have to cover your reactor. It can handle pretty much anything. So it's super robust in terms of kind of the conditions of your laboratory. You don't need to worry about any of that. The device itself, so the hub has its own completely embedded application and operating systems. So you can have analytical or analog and digital feed control outputs. You can export the data, both the predictions and the spectra in CSV format. You can monitor the process of your bioprocess run just through OPC UA adherence. You can be sitting on your couch and see how your bioprocess is running. And again, you can multiplex up to 6 of these measurement modules to one hub to monitor in parallel up to 6 different reactors. And with that, I'd like to hand it over to my colleague Steph, who actually uses the MAVERICK in our lab at 908, who has some data showing the MAVERICK kind of in action.
Awesome. Yeah, thanks, Steve. Obviously, Steve's done an awesome job giving us a really great background on sort of how MAVERICK works and what makes it so special. But what I want to do now is kind of talk a little bit about how MAVERICK translates directly into the lab and can be incredibly user-friendly for cell culture scientists such as myself. So first off, there's really only 5 essentials you need to get started. So we have the immersion probe, which is what's going to sit in the bioreactor itself. We have the measurement module. We have the hub, which is what's going to actually display the data on the screen, the software, and the calibration kits and accessories. As Steve mentioned before, it's really also important to note that the multiplexing is possible. So for me, I could be working with 6 different reactors and have them all hooked up to basically one hub and displaying the data from each of those reactors all very concisely and in one place. So in terms of the actual setup for MAVERICK, it's incredibly simple, requiring really only 3 steps: the calibration, the autoclaving, and the basically pressing start. Better yet, as Steve mentioned, it's a very, very simple 2-point calibration, which the system guides you through step by step. I've personally found it, equatable or oftentimes easier than calibrating our pH probes in lab. So basically, once we've gone through these 3 simple steps, we're all ready to go with kind of our real-time glucose, lactate, and biomass readings. But I guess the question to ask then is, why do we really care about measuring glucose and lactate and things like that in real time? Well, recent trends in pharmaceutical industry have seen progress towards things like intensified processes, which have higher nutrient demands, particularly for things like glucose. But if you're trying to kind of combat that by doing high bolus glucose feeds, there's a potential for the buildup of sort of toxic metabolites that can accumulate, particularly in fed batch and perfusion cultures. And these can have detrimental impacts on things like critical quality attributes. Some ways you might try to overcome that is basically by increasing your at-line sampling, but that's very time and labor intensive and isn't quite easily translatable to a GMP environment. So a lot of people have looked into implementing some RAMAN-based monitoring coupled with automated feeding, which offers a good solution. But as Steve spent a nice time telling us about, it requires a lot of prior bioprocess runs and chemometric modeling expertise and is often difficult to implement. So in our case, we have enter MAVERICK, where real-time control can be implemented instantaneously right out of the box in a user-friendly way, which basically will increase accessibility to that inline glucose and lactate monitoring control, which is a direction that the industry as a whole seems to kind of want to move towards. But you don't have to take my word for it. There's plenty of examples out there in literature, some displayed here, evaluating the implementation and process improvements that we've seen via RAMAN-based glucose and lactate control. And these improvements include things like increased process robustness, increased yield, and improved product quality attributes. So there's a good example of kind of a few studies that have been done. Now, without MAVERICK, if I wanted to conduct these studies in my lab, I would either need to spend a significant amount of time developing and building these models, or more likely employ a team of people who know how to do that stuff way better than I do. But since we have MAVERICK and that's not the case, what I really want to take some time to do is show you kind of 2 case studies that we've been able to conduct in-house here with the deployment of MAVERICK for instantaneous access to that real-time RAMAN data, as well as some RAMAN-based feeding. So jumping in, the first case study I want to discuss here is a dynamic glucose feed to enhance process performance and critical quality attributes. Before we dive too deep in, I just want to orient everyone to the specific CQAs that we looked at during these studies, so we're sort of all just on the same page here. The first one is glycosylation, which includes things like galactosylation, fucosylation, and the addition of other sugars. And this has been shown to impact things like efficacy, safety, stability, half-life of monoclonal antibodies. For our particular studies, we're considering sort of our criteria for success here to be sort of an increase in those heavily galactosylated forms, so the G1 and G2 glycoforms, and less of our sort of low galactosylation forms, so the G0s there. Since increased galactosylation can basically enhance efficacy through complement-dependent cytotoxicity. The next quality attribute that we focused on was glycation, which is the non-enzymatic addition of sugar residues to the protein amine groups. Since glycation basically has the potential to block functional sites, we would consider a lower percent of glycation on the antibody a huge success in this area. And finally, we have our charge variance, which is just a post-translational modification that alters the isoelectric point of the MAB. MABs are typically kind of fall into three main categories with the charge variance. There's a main species, and then there's basic and acidic species. And those basic and acidic species have the potential to have detrimental impacts on things like safety and efficacy as well. So what we would want to see here is basically an increase in the percentage of MABs that we're getting in our main peak and less in those acidic and basic peaks. All right, so now that we're all on the same page, let's dive right into our first case study. So as mentioned, we are looking at a continuous glucose feed. And for this case, we chose a set point of 2 grams per liter for the continuous feed. And the control culture had a bolus glucose feed that was fed every time the offline measurement was below 4 grams per liter, and it was fed to a target set point of 6 grams per liter. So we cultured with the NISCHO cells producing the NISMAB in a 3-liter Distech bioreactor with the Excel Advanced media, and they were fed, the standard 5% volume every other day of the Excel feed 1. And for this particular study, we were able to use MAVEN for the online glucose control, MAVERICK for inline glucose and lactate monitoring, and we were actually able to incorporate ZipChip here for our CQA analysis. And then sort of as some other benchmarks for process performance and things like that, we have the BiCell for our viable cell density and viability measurements, and then the Bioprofile Flex 2 for our offline glucose, lactate, glutamine, glutamate, and ammonia. So when we look at the results from the 2 cultures, we see that the VCD profiles were very similar, but we're noticing that the 2 gram per liter continuous glucose feed resulted in overall higher titer as well as higher cell-specific productivity. So looking at this, there's a definite improvement here in general process performance. So for our next slide, we are looking at sort of the glucose, lactate, and ammonia profiles for the 2 cultures. Now, there's a few things that I want to point out on this slide. First, that the MAVEN, as you can see from the left graph with the glucose, the blue line there, is doing a great job at controlling the glucose to our 2 gram per liter set point. The control is extremely tight, extremely reliable. So really nice job getting the separation there. Second, the continuous glucose feeding resulted in both lower lactate and ammonium accumulation at the end of the cultures, which is sometimes beneficial for those product quality attributes. And finally, and possibly most importantly for this talk, is the correlation between the MAVERICK measurements and the at-line data. So you can see kind of our online data there from MAVERICK matching really, really well with both in terms of both the glucose and the lactate to those offline flex readings. So that's exactly what we would hope to see out of the performance from MAVERICK. And then moving on to some of our product quality results here. First up, we have our charge variance. So as mentioned before, we would want to see kind of the percentage moving away from those acidic and basic species and into that main species category. And we can see that just by implementing the continuous glucose feeding at 2 grams per liter, we are able to achieve a higher percentage of our MABs in that main peak and away from those variant peaks. So definitely a success in terms of the charge variant heterogeneity in this experiment here. Next, we have the glycosylation data. Again, what we want to see, just to remind you, is moving towards those more mature G1 and G2 glycoforms and away from those less mature G0 glycoforms, which is what this graph is showing. But I think we have it broken down a little bit in a little bit more of a digestible manner on the next slide here. Or if we look at the bottom row here, we've kind of totaled up the G0s and the G1 and 2 forms. So you can see that across culture time, so even beginning on day 8 all the way through day 12 and 13, that the continuous glucose feed at that 2 gram per liter set point has a higher percentage of those G1 and G2 glycoforms when compared to the standard bolus feed from the other reactor. And then finally, and probably most evidently, we have our glycation. So again, that's that non-enzymatic addition of sugar residues. And the results here were actually very, very promising, almost astonishing, very exciting to see that having that 2 gram per liter set point really throughout the culture decreases that percent glycation on our MABs. And you can see a significant difference as early as day 8. And then all the way through the end of the culture, you're not getting that increase in percent glycation that you can see in the bolus feed. You're having a very small percentage that's very consistent throughout the entire duration of the culture. So again, just to reiterate that the 2 gram per liter continuous glucose feed significantly reduces the glycation, and then we consider that a huge success in terms of having a positive effect on protein quality. So the next case study that I kind of want to discuss is implementing the MAVERICK for a RAMAN-based lactate feed with the goal essentially of decreasing the ammonium that's built up in the culture and enhancing process performance CQAs. So a lot of the kind of experimental conditions are very similar, so I'm not going to dive too deep into that, but it is all there on the left in case you're interested. But essentially in this study, we used NISCHO to kind of evaluate the impacts of implementing a 1.5 gram per liter lactate set point feed after lactate consumption begins. So essentially what this is saying is when lactate is going through kind of its typical profile in the culture, we start with an accumulation phase. There's usually a point where then the lactate metabolism switches to a consumption, and then it will usually bottom out. What we're trying to do here after with the lactate feed is after that consumption begins, we're trying to keep it at a level where we're avoiding that sort of bottoming out. And we're hoping that that will show us a decrease in ammonium accumulation and in turn some positive impacts on product quality. Again, in this case, we use MAVERICK for the inline glucose monitoring. and lactate monitoring, but we were also able to implement it for the lactate control as well. For this study also, we used Rebel to look at some at-line amino acids, and then again employed that zip chip for those critical quality attribute analysis. All right, so moving into kind of our just culture performance. Generally, the culture performance was pretty comparable. The max VCD between the two cultures is very similar, but we did have kind of a discrepancy here with the seeding densities. So that kind of translates in the final titer and the cell-specific productivity and things like that. So basically, future work will focus on essentially reevaluating this at more comparable seeding densities. But the fact that the max VCD is still very comparable is promising. And even more promising is when we look at our metabolite profiles. So as you can see, we have our glucose, our lactate, and our ammonium here. And you can see that the higher lactate, so the blue one that's kind of maintained at that higher value and doesn't dip down, has significantly lower ammonium accumulation at the end of the culture. And this is exactly what we would hope to see from keeping that lactate high. That was kind of the whole goal of it. So it really shows sort of the potential application for MAVERICK here to be able to really reduce inhibitory byproducts in our culture. And then once again, just to point out that the online MAVERICK data and the offline Flex data, again, matches really, really well. So moving forward into, again, our product quality attributes here. In terms of the charge variance, we're seeing that same sort of shift away from the acidic and the basic species and moving towards that main peak kind of species there. And again, that's exactly what we would want to see from having a more kind of homogeneous charge variant profile. I forgot to mention before, but I will in no way pretend to be a zip chip charge variant analysis expert. So if you are interested in learning a little bit more about that and kind of how that works, please see the link. That should tell you pretty much everything you could hopefully ever want to know about that. All right, and then we have, again, our glycosylation. And similar trend as we saw before, we're kind of getting more towards those mature G1 and G2 glycoforms and away from the G0 glycoforms. A little bit less dramatic here, but still a step in the right direction. And this will definitely be something that'll be interesting to keep an eye on when we repeat the experiment with a little bit better matching growth profiles. And then finally, we were able to actually do some analysis with Rebel to confirm some potential mechanisms as to why we're seeing that big difference in the ammonium accumulation. And this part's really exciting because for the most part, when we evaluate the amino acids, there's not a huge difference in what's happening between the lactate-fed culture and the non-lactate-fed culture, except for with alanine, which we would expect because alanine is closely related to that kind of ammonia metabolism. So it's really awesome that we were able to confirm this with Rebel. So the big distinguishing difference here is that in our lactate-fed culture, we have just like a constant increase in the alanine, whereas in our control culture, we see that very, that small shift from the alanine production to consumption. And essentially what's happening here is because we're supplementing lactate, and lactate is in a sufficient enough concentration to act as a pyruvate source for glycolysis, there's never really that need to pull in alanine to act as that alternative pyruvate source. And it's that transition from alanine to pyruvate that oftentimes releases a free ammonium ion into the culture and can build up and have negative effects on culture performance and product quality. So being able to kind of see the results from the MAVERICK lactate control with the lower ammonium and be able to confirm exactly what we would expect with Rebel is just really, really high value information there. If you want more information on Rebel, I think there's a link there as well. Learn a little bit more about how you can kind of compare your spent media. All right, so in summary, we've been able to kind of show how MAVERICK can be an effective tool for both our glucose and lactate monitoring, as well as our kind of more novel feed control strategies here. In the continuous glucose feeding, we were able to show an improved titer, improved cell-specific productivity, as well as improved CQAs. And in the lactate feeding, we were able to show kind of that improved ammonia profile and also the quality attributes as well. But the beauty of it all here is that these are experiments that I performed back to back, two totally different experiments with the same MAVERICK probes, measurement modules, hub, all that. And the only thing I had to do between moving it from one reactor to the other was that very simple 2-point calibration, and it was ready to rumble for our next application. So nothing complicated in between, really easy to transition. And as scientists who want to spend more time doing science than anything else, it's just perfect. So hopefully throughout this talk, we've been able to give you some ideas of ways that, without calibration models and with some plug and play integration, you also might be able to implement some Raman for, continuous process monitoring and control to get the most out of your maps. So yeah, thanks for your attention, and we'd be happy to take some questions. Thanks.
All right. This was such a great presentation, Steve and Steph. Thanks so much. We really enjoyed it. And I've got a ton of questions coming in. Audience members, please continue to submit your questions. We're going to get to as many as we can during this Q&A. In addition, on your screen, you should see kind of the contact information, emails for our speakers on the, I believe, right side of your screen. You can reach out to them there real quick if you had additional questions. And then on the upper left corner, there should be 4 resources, great resources about the topic today. I suggest just downloading all of them. Lots of really good information in there. And then, if you have any more questions or anything, or are looking for anything specific, you can reach out to me as well. I should be on that screen for contact as well. But with that, let's get into the questions. All right, so first in, they're asking, when we buy any of the instruments, they come with already trained data sets for these analytics analyses. Can these analytes be customized to each customer's needs?
Right, so we're actually not doing any training in the kind of typical sense. So there's not some huge data set that we train over for these analytes. It really is that prior formulary that we have in there. So in our case, glucose, lactate, and everything else that we expect to be in there. This can be expanded, and we do plan to expand it over time, but there's no customer specific training that needs to be done. That's all kind of handled in the mathematical framework, the way we've developed it.
Perfect. Thanks, Steve. All right, up next. So they're asking, how is your technology positioned for product of interest, quantification, glycosylation patterns compared to others like Merck and Ramina?
Yeah, so the product-specific quantification is not something the de novo model can do kind of easily. It's kind of very general, since we're doing this kind of from first principles. So the usual approach that people do for that is something like PLS, where you're modeling a specific or trying to predict a specific product quantification. But saying that, you can certainly use the spectra generated by MAVERICK to build those specific models for that quantification of a product that you want to predict.
Great. Yeah, thanks, Steve. Let's see. Up next. So they said it's mentioned, or you mentioned mammalian culture. Is it possible to use it on microbial cultures as well?
Hi. Yeah, so we specifically use mammalian culture. There shouldn't be an issue with the cell type inherently with switching to microbial, but where there would be some issues is when there may be the use of a undefined culture, or undefined cell culture media that have things like hydrolysates in them. This is really meant for a fully defined cell culture media. So as long as you're using that with your microbial system, it should be okay. But other than that, it would cause a little bit of possible issues there.
Perfect. Thanks, Steph. All right. So I've got a question here talking about diclofenac potassium and diclofenac sodium in Bioprocess. And I'm wondering, they're basically asking, can MAVERICK handle these? Can it, work with them?
Yeah. So the diclofenac, that is not actually in our formulary of our model, but we could certainly work with you on determining whether or not that's actually even necessary. So the case there would be if it has some Raman active response that interferes with our analytes that are already in the model. And if that is the case, we can look at adding it into the kind of the formulary to see if it's possible to do predictions on it or take it into account when you're doing or monitoring with MAVERICK, whatever your bioprocess is.
Awesome. Thanks, Steve. Up next, which parameters are required from Bioprofile Flex 2, and do you compare the data of glucose and lactate inline with offline, like the Bioprofile Flex 2 data?
Yeah, so because we're not really training a model here, no data from the Flex is actually required. Basically, what you've seen data-wise in the presentation is simply just the comparison of the inline glucose and lactate to the offline. But none of that data is actually required to be implemented into MAVERICK to get the data that match. This is just kind of how it matches out of the box. And that's sort of our standard right now for offline comparison. So again, none of it's required, but those comparisons that you saw in the presentation were just that, the inline offline comparison.
Gotcha. Thanks, Steph. All right, we've got a few more coming in here. Again, the Q&A is in the bottom left corner of your screen, audience members. Feel free to submit stuff. We've got some time here to get to a couple more, but if we don't get to yours, I'm gonna pass these along to Steph and Steve for potential follow-ups. So really don't worry if we don't get to them. And if something's too specific, I'll pass it along as well, and they'll be able to help handle it offline with you. So yeah, let's get into another one here. Is there a model in MAVERICK that improves as the number of studied processes increases? And does it mean as you use MAVERICK more and more, it becomes more experienced or more of an expert?
Yeah, I'll take that one. So not necessarily, or not at all, actually. There's no self-learning going on within a specific bioprocess. We don't store the state of that and try to do better as we see the same process going forward. It's really a general model to predict over kind of the full space of these common bioprocesses you see for mammalian and HEC cultures.
Awesome. Yeah, thanks, Steve. Let's see. I'll get into some of these. A couple came in a little earlier. Could you talk about, Steve, probably for you, what are the first steps needed to set up platforms for inline monitoring? Yeah,
so there's kind of, I would say, 4 steps that you need to do to get up and running with MAVERICK for inline monitoring. First, you need to do something we call the performance qualification for each probe and measurement module combination. This is just a measurement of 2 standard solutions just to make sure everything is running correctly before we actually start monitoring a reactor. At the same time, we also do a 2-point calibration with those solutions. And then step 2 would be you autoclave, sterilize the probe, get it in your reactor, fill your reactor, and then finally connect the probe to the MAVERICK measurement module probe adapter, and then press start on the hub, and then you're up and running. So not a lot to get going. It's really just kind of like a pH meter.
Yeah, awesome. Perfect. Sounds good. Thanks, Steve. I guess, so I'll stick with you. I think this is probably for you as well. Do I need to adjust the model for my specific process?
Yeah, so I kind of went over this a bit earlier as well with some other questions. The general answer is no, unless you're doing something that's extremely different from what's kind of traditionally done for mammalian and HEC cultures. The model should work as is. But saying that, or with that said, we do offer what we call the fast referencing for the predictions. So if you take a measurement with your Flex and you see that there's a kind of delta between those concentrations, you can actually fast reference MAVERICK to the Flex so that all future predictions will have that offset kind of applied there as well.
Awesome. Thanks, Steve. Let's see. Steph, probably for you here, can the MAVERICK device scale up to larger bioreactors?
Sure. Yeah, like I mentioned, it was 3-liter reactors we used for this particular presentation, but we tested all the way up to 10 liters, and it should be pretty scalable. The model itself is kind of agnostic of scale, so that's something that should kind of carry throughout. So we feel pretty good about that there.
Gotcha. All right. And sticking with you, what other cell lines have you tested with the MAVERICK?
Yeah, we've gone ahead. Like I said, this was with NIST CHO, but we've used some CHO-S cell lines, some HEC-293 cell lines, so getting kind of a little bit of variety there, some GS-CHO, and then a whole slew of media as well. We probably have a slide somewhere we can attach elsewhere that might describe that.
Yeah, perfect. Let's see. So someone was asking, could you talk more about what you mean by 2-point calibration before starting?
Yeah, I'll take that one. So this is similar to a calibration of what you'd see in a pH probe. So the 2-point calibration process is done by measuring 2 standards, so a high and a low standard. These contain glucose and lactate at high and low concentrations. And then we adjust the future predictions from our model using the slope and bias from this. It's just a traditional 2-point calibration.
Perfect. Yeah. Thanks, Steve. Let's see. So, so they had kind of a follow-up on it too. Which parameters are you adjusting when performing calibration, and do I need to perform any calculations myself?
Yeah, that's a good question. So there's nothing you need to do on the user side for this 2-point calibration. We're adjusting quite literally the slope and bias of the predictions that we're seeing from the model.
All right. Awesome. Thanks, Steve. I think this is probably going to be a good place to wrap up for us today. Audience members, again, if we didn't get to your question, I'm going to pass those along to Steve and Steph for follow-up after this event. And if you have any more questions, please feel free to submit them right now. I'll pass those along. And if you don't, you can reach out to any of us on the right side of your screen, or get in touch with me with any of the emails that you get from us, and I'll get you connected to the right person as well. So with that, I just wanted to say, Steve, Steph, thanks so much for this great presentation. We got through, a dozen questions here. Really appreciate you being here, and this is some fascinating stuff, and it's great seeing what you guys are doing. And audience members, thank you so much for joining us. Appreciate your time today. We hope you all have a great rest of your day, and we'll see you next time. Bye, everybody.